So my training was in family medicine, and I had a fairly conventional residency at the Penn State Hershey Medical Center in Hershey, Pennsylvania. And my early experiences in medicine were fairly typical, I think, in that I was trained in clinics where I would see as many people as possible in the course of a day. Sometimes that could be 30 or more people. And literally when you're doing that, you're just running all day. One of my first jobs was working in a VA hospital that had something like 1,200 beds, and there was never time to sit down for 5 minutes. We were literally just running as fast as we could. So when I went into family practice, I was resolved that I wanted to do things differently because I wanted to have a chance to interact with people. And when I began studying functional medicine, which was very early in my career, I got the reinforcement, I should say. I got support for the notion that I could spend as much time with people as I needed. And I would say this time difference is one of the main things that you would see that's different about someone who practices functional medicine versus conventional medicine. In conventional medicine, the idea is to get in and out as quickly as possible, to get that diagnostic code, to come up with a treatment plan, and then on to the next person. With functional medicine, the idea is to sit down with the person to really get to know them, to understand their story, to know what their narrative is on a very deep level, and to go beyond the narrative to really starting to look at, well, what are the things that predispose them to the illness, and what are the triggers in their lifestyle? What about their diet? What about their stress level? What about their living conditions? What is it about those things that might be triggering the problems that they're experiencing? And what are the things that are perpetuating the problem? Are there things in the diet that may be increasing inflammation? Are they eating a diet that's got a lot of inflammatory fats, for example? Well, that sort of thing takes a long time. The information gathering process is a very involved and elaborate process. And what I will say to those of you who wonder, well, can I do this? This is really different than my typical practice, that I continuously get feedback from patients that they feel like this is the first time a doctor has actually listened to them. A first time a doctor has actually cared about what was really going on with them, because they really felt like they were a human being that was involved in a true relationship with another human being, as opposed to just another number who was being assigned the diagnosis. So the time difference is probably the thing that stands out the most. Now I would typically see 4 to 6 patients a day on a busy day. And sometimes I'll spend up to 2 hours with an individual patient. And I can say that it's very rewarding to do that. I don't see the people as often. If you see somebody for 3 to 5 minutes, you may have to have them come back in a few days for follow-up. On the other hand, if you see them for an hour and a half or 2 hours, you can give them a lot of instructions and you can give them a lot of ideas about what they should do if they encounter certain scenarios. So I can map out different algorithms for people. You know, if you don't get better, then add this, etc. So I'm giving them a lot of tools that they can use for self-care. So I would say that this is a very, very rewarding way to do practice.